also reporting that there have been a total number of 47,398 individuals tested. If you go to the DHS website, you can actually see all the information and break it down by county. If you clicked on the map, you go from there to get more detailed numbers. So as you can see, obviously this has been an issue that we've been dealing with for a while. How we responded is we formed a COVID-19 response team, which I chair, which is made up of a variety of physician members with specific areas of expertise, from ID to ED to family practice. It really is trying to hit a broad range of people. I joke with people saying, yeah, I am a surgeon, so I don't claim to have the content expertise, but kind of more of the approach of how to triage issues and move things forward. We've been working directly with DHS. In fact, we have weekly calls with them. We work with community stakeholders to addressing all the needs and impacts, and we've really kind of branched to a variety of areas to try to help our members. We've had direct dialogue multiple times with the governor's office to provide input on executive orders, and also before and after, and really try to keep those lines of communication open, going out of our way to be a resource for these institutions as they make decisions on what happens and what we do next. Some quick things on what we've hit. The Ppe and testing, that is obviously front and foremost on everyone's mind all the time. We reiterate that discussions when we talk to DHS and the governor's office. Many of you may have gotten starting to see that we are working on trying to get PPE to our members, and there's a variety of ways we're approaching doing that now, not just through lobbying efforts, but also through connecting through a variety of ways with actually distributors. Telemedicine coverage and platforms. Obviously, telemedicine has taken over. I could say at my institution, we went from 0 to almost 8,000 visits in a couple of weeks. And so what we're doing now is that we're making sure that we are covered. We've met with all the insurance companies to make sure that telemedicine is covered, and that we are also we're making sure we're getting reimbursed for it, and that everyone knows how to use it. And then obviously we're going to be looking as going forward as what to do in the future, because this will always be like this. Med-mal, I'm sure many of you saw the executive order that came out last week with the governor. We had requested some sort of protective, as well as the hospitals have asked for some sort of protection during this time. So there's kind of a good Samaritan law put in where it's not for everything, because it shouldn't be for everything. But I think related to the COVID-19 treatment plans, there is some liability protection now. The governor felt comfortable working around that. I know our Constitution puts up some interesting barriers, but they found using this way helps cover, so we have some protection during this time. We've all really trying to give some overall support in general. We actually have a scheduled call tomorrow with the governor's office regarding elective surgery. I know the president made an announcement tonight about it, so I'm sure that will accelerate things. But we really want to make sure things like that are done appropriately regarding recommended with certain organizations with their guidelines. So these are the day-to-day things we come up with. So every time an executive order comes up, like the pharmacy one, as soon as that one came out, we made a point of reaching out and working with the pharmacy board to make sure that those executive orders still fall in line with current law and our current practices, that it's safe for all patients. So I can trust you that Libby's probably tired of talking to me already, because we talk about it almost every few hours now, because that's how rapid things are changing. But fortunately, I would say we have a great team on top of everything, and we kind of deal with it as it comes up. So it really has been an all hands on deck effort with all of this. Damon, you want to go to the next slide, I think? And then just so you know, we do have resources online that are being updated quite frequently. The website's right there. It's all through our azmed.org. Obviously, it's either coronavirus or COVID-19 has got kind of its web address, which is not a surprise. These just get frequently updated. But obviously, if you ever have questions, we are here to answer them. And like I said, we are on top of this every day, hour by hour, really trying to address things as they come up. And I think I've had a good presence with all the stakeholders, making sure they know that the physicians of Arizona not only are well represented, but are being heard and listened to. Are we perfect? No, no one is. Are things moving really fast? Yes, they are. But I can promise you that we are trying to stay on top of all of it the best we can. That's all I have. I will turn it back to Damien and go. Well, I think we'll open up for Q&A, it sounds like.
Great. Yes. Thank you, Dr. Goldberg. So yeah, at this time we'll open up. We really wanted to keep our presentation short and sweet and open it up for question and answers from the audience for the next 40, 45 minutes or so. So if anybody would like to submit any questions, feel free to hit the Q&A part at the bottom, or raise your hand if you'd like to ask questions. We do have some questions as well that I'm going to stop sharing my screen here so we can see all the panelists. Some questions that were submitted in advance as well that we would be happy to get started with answering off the bat if we don't have any questions right away from the audience.
And Damien, I want to also let all the audience members know that this is the first time we're doing it. We kept it light with the presentation, more to Q&A, but there is ideas of how frequently we're going to do this. Also have invited guests to give you guys direct updates as well. So this is just our first one at this. So again, we want to keep it a little lighter as far as presentations and really let it open up for you guys. And then we'll go from there. And we want the feedback on this as well, what you think worked, did not work, and how we can make it a better interactive platform for you.
Yes, and thank you, Dr. Goldberg. And just as a reminder as well, all of the attendees are on mute, so we cannot hear you at this time. So the best way for you to ask your questions is either through the Q&A, or you do have an opportunity to raise your hand, and we can go ahead and switch over to you at this time. We'll go ahead and start off this with a question that was submitted prior to the beginning of the town hall tonight. Question from a physician was, there have been numerous social media and mainstream media reports about healthcare systems requiring physicians to engage in frontline work while also being subjected to inadequate provisions of PPE as well as pay cuts. What are ArMA's plans to engage in advocacy for physicians at the front lines of the COVID-19 pandemic?
So I guess I should start with that one, maybe.
Go ahead.
We are actively advocating on all behalf for all physicians. Again, one thing I'll take the two different parts separately. Financially, obviously, we have no control over if healthcare systems are cutting salaries. I am aware of it. It's happening nationally. There is an economic impact to all of this. There are resources on the federal level. Some of you, if you may have gotten a direct deposit in the last couple of days from United Health Group, that is that first round of the $30 billion that came from the CARES Act that was released. United has asked to distribute it out. So United actually purposely gave you money. It wasn't that you missed a claim, and that's a payment, not a loan. So there are certain things on the federal level and the state level they're working on. We obviously advocate and have talked with the governor's office as well as other stakeholders regarding financial support and awareness that private practice groups are small businesses and need to be reminded that they are that. And so there are issues that go along from the economic standpoint. The hope is that we get things up and going so that the cuts are not permanent, they're temporary, but obviously things are changing minute by minute. So we're aware of that. As far as protective gear, we lobby for PPE stuff all the time. I would say this, and I'll say it publicly, and I would talk to all the physicians, those of you who went through ACLS training, the advanced cardiac life support, the very first thing it says when you come upon a scene is to make sure the scene is safe. Otherwise, do not approach. I would say take this same approach here, and I've advocated that for myself and my colleagues as well. If you don't have the stuff to protect yourself going in somewhere, you shouldn't be going in. You should not put your life at risk. So, and I will stand by that statement 100 times over. I have colleagues across the country that feel very nervous. You know, I have reused masks. There are ways to reuse it safely, but we will advocate that we need more equipment. But if we have a healthcare worker who's being put at risk, that is not worth the effort. There needs to be a balance here. We are all here to take care of everyone, but if we all go down, there's no one left behind us. So we push very hard to make sure that we have adequate coverage, but I will stand up against anyone that would force any physician or healthcare worker to work in an unsafe environment, and would publicly stand up for that, so you know.
This is Libby. I will just add to that what Dr. Goldberg said. So we understand that this has been a significant economic impact for the physician community and healthcare across our state. In addition to the things that Dr. Goldberg said, I can also share that we know that CMS has implemented an advanced accelerated payment model. We are working with Access and across the state to do the same for all those that see Access patients, and Access has submitted a request through CMS for a waiver in that area. We also know that the insurers, some of the major insurers, are implementing similar programs that are accelerated advanced payment models, because we know that physician practices can't stay afloat for a significant period of time without some kind of infusion of cash. So those are the things, in addition to working with the governor's office and making an ask for more of the federal money in the form of stipends for physician practices. All of this is a work in progress, but we're doing everything we can to get support for each of you so you can continue to thrive in this environment.
Great. Does anybody else have any comments on this as well before I move on to the next question? Okay, I have another user or attendee has submitted a question asking, what is ArMA's position on resuming elective surgery? How do you feel these would be best resumed to preserve safety for all and preserve resources?
So as a general surgeon who's been impacted by this, this is near and dear to my heart. Like I said, I may not know much, but I do know a little something about surgery, hopefully. There are recommendations out there from the American College of Surgeons, from SAGES. There are recent articles published on ways to protocolize how you prepare for surgery. One thing is that, and actually I'm be bringing it up tomorrow, so it's not a secret, is that yes, we need to integrate in less urgent, more elective cases over time, but we need to also protect the patient and the healthcare staff as well. So that's going to require more robust testing. If you don't have testing, maybe you have to assume the patient's COVID positive, depending on what the case you're doing, and treat it with N95 masks and have PPE available. So I do think we need to have elective surgery slowly weaned in. You do the more urgent ones now and kind of over time do it. It needs to be a smart process in how we do things, though. And one thing that we're also advocating for is that it's not a free-for-all, right? You don't want to give advantages to the large systems that can capitalize and say, oh, we'll open everything, and sabotage the smaller systems that can't ramp up as quickly. There needs to be equal distribution because, again, that's a continued financial hit. So we've got to make sure that everyone has the opportunity the best they can to open back up and go back to as things were, but we need to do it in a slow fashion. The month of April should not be the month we do this. We have not hit our surge yet. The surge is still projected for the end of the month. We should wait till at least that is done. But the smart thing would be is to start preparing now for that so we can start ramping up as soon as possible. I think we need to have better testing and better PPE availability, which is what we're going to bring up with the governor's office tomorrow, to make sure that this is able to do that. But again, we'll have to gradate. There are some models out there on what to call urgent versus pure elective. And I think the pure elective is what you do last. Gallbladder hernias, for speaking as a general surgeon, there's a broad range of urgent to really you can wait. And we have to kind of quantify that and really be careful how we do it. But I think we can start integrating it back in as long as we're smart and cautious about it. And we use real data. We don't like use made up stuff. There's actual data out there now, so I'm all fan of using the actual data as guidance.
Great. Thank you, Dr. Goldberg. So the next question I have here, according to the Arizona website, it appears there are on average about 1,500 tests being done per day. What is the total testing capacity per day? And if there are opportunities to more fully use the daily testing capacity, how should the testing requirements be expanded, especially given the potential for asymptomatic patients being most infective during the 2 to 3 days prior to symptoms?
I was looking at me to start. Okay. I agree. This is, we have been in frequent discussion with DHS about this. I personally do not know the number. I think we're actually trying to figure out what is the total testing capacity. You can follow the trends that there's been some little downtrend, which is you've seen nationally. We don't have the best data on it. Agree. And we actually we have on our own also trying to reach out and kind of culminate some of that data as well. Ideally, we should be maximizing it out. We all agree on that. But part of the problem isn't always that it's not that we can't have the tests, is do we have the reagents? Do we have the swabs? There are pieces to these tests sometimes that are missing, which impact the ability to do the test as well. I think we need to, we're trying to coalesce and put together a more robust listing of sites available for everyone so they know. That is still a challenge that we are addressing that we do bring up every time. I give Libby lots of credit. It's like the first thing we ask is, so what's going on with the testing and how are things? It is not perfect. There are sites, my hospital does some. I know other hospitals around the valley do some in the state. Could it be better? Yes, we're working on that. The FDA keeps on releasing new versions of tests that are quicker. That new saliva one came out recently. So there are new opportunities too that maybe will help. I do know that DHS is hoping the market is going to kick in soon, and it looks like it may be. Or if the market catches up, we'll have more rapid dissemination of tests, which will be very helpful because we're going to need them for things like elective surgeries and everything else.
This is Libby. I would just add that we know that testing and PPE have been some of the biggest challenges right now across not just our state, but really across the country. As Dr. Goldberg said, we don't have a good assessment at this point of where testing capabilities lie, even though we have regular conversations with ADHS. And so what we have taken the initiative to do is to reach out to the individual labs and try to get some information that we will then share with our members. So that's a work in progress right now. Hopefully it's something we'll be able to share as early as next week so that there's a better understanding of what the lab capacity is and where specific testing sites are available.
Great. Thank you. We'll move on to the next question here. I'm going to go ahead with one of the, there seems to be some quite a few questions around PPE. So I'll address the question that we received prior to this and combine it with a couple of, kind of try and combine all the questions together here. And I think we'll be able to address quite a few of them with one response. One of the questions that was submitted prior to tonight's town hall was if we have an update on ArMA's PPE order with our partnership with MCMS, and how close are we to meeting that quota so it can go forward. And then another question from one of the attendees tonight is what percentage of Arizona healthcare providers do not have adequate PPE currently? I'm not sure if we would know that percentage off the top of our heads here, but I figured maybe we can cut to Juliana, maybe talk a little bit about the PPE that's going on right now in ArMA's efforts.
Yes. We are in the process of helping Arizona physicians obtain the PPE that they need. We launched an effort about a week ago to allow physicians to order KN95 masks, disposable masks, and disposable gowns. And we've placed our first order on behalf of Arizona Medical Association members and Maricopa County Medical Society members. We are going to open that up to other orders so that more physicians can get the PPE that they need. And also, there was another part of that question. Damien, help me out here a second.
Yes.
The link.
So there was the PPE update on the PPE order, meeting the quota, and then as well as there was percentage to that. But then there's also how to access the PPE and the ordering sites and such, and what our plans are moving forward with that too. Right.
So the link for the PPE order is actually available on our website. When you go to azmed.org, and there's a link right there at the top of the page. The banner pops up. So that'll take you straight there and you can order what you need. We will be expecting orders to be delivered within a couple of weeks from the time that we can place the order. That gets complicated. So we can talk about that later if you'd like offline. The percentage of physicians who don't have PPE or practices that don't have PPE is actually a question that's going to be in our survey too. And we have a survey going out probably Monday or Tuesday that will ask questions like, how has COVID-19 impacted your practice? What's the availability of PPE that you have? Who needs it? What's the decrease in revenue? What's the decrease in volume of patients seen right now? And how is telemedicine working out for you? So when you see that link, to, or the invitation to the survey, please follow the link and answer that. That's a survey that can be answered by either a physician or by your practice manager. But it's important that we get the information so that we can help out with that.
I have just one other thing to add in terms of the statewide capacity and needs around PPE. ADHS, has prioritized the need for PPE for hospitals and long-term care facilities. And I think that they've shared with us that they understand that the community physicians and private practices are significantly disadvantaged because of that. And so that's why ArMA really started this initiative to try to get PPE to all those that need it in the state, because we know what a limited supply there is. When we talked to DHS earlier this week, they stated that they had some data that about 75% of all the hospitals that are reporting to them indicated that they thought that their PPE was adequate based on current need. That doesn't mean that next week, if the surge is, if the numbers significantly increase, that their needs are going to be met in the same way. But we are hearing that hospitals are fairly adequately supplied, and so we definitely need to push to have greater PPE throughout the community.
Great. Thank you both for your response to that. I've got another question here from one of our attendees. Have there been any hospitals in AZ who have maxed out their ICU bed capacity?
I don't know personally. I know there are some higher numbers. Flagstaff I know was quite busy. I talked to someone yesterday, 2 days ago, where one of the banner hospitals in Phoenix had a good number of people set up. I don't know personally offhand. I don't know if anyone else on the panel does. You're seeing a smattering depending on who you talk to. It's interesting to try to keep track of that. I will give credit because I not just because she's in the attendee list, but we were talking with Dr. Whiteley, our immediate past president, and we really want to give credit to all the family physicians and general practitioners out there who are actually trying very hard to take care of these patients in an outpatient basis to not overwhelm the ED. So I think we're seeing a lot of people not be overwhelmed because they're really on top of these patients in an outpatient setting, which helps. We've learned a lot from the rest of the world. There are advantages, like I said on another call previously, there's advantages right now to not being first. This is a good time to not be first at something, and so that we're actually learning and being better prepared, I think. So I think that's why you're seeing our ability to handle this is a little better. Not perfect, but definitely improved maybe with some compared to some other places around the country and the world.
Great, thank you, Dr. Goldberg. Another question that was submitted prior to the town hall tonight. So is, do we know if or when the legislative session may start back up? Maybe Megan or John might be able to start this one off.
Yeah, this is John Amoris. As you know, the legislature had, I guess, overly optimistic plans to come out of recess a few days ago, and they abandoned that. And now the plan is to, for lack of a better word, kind of just circle back at the end of the month and see where we are, and then kind of make that call as to whether they can, in some fashion, convene. So that's not particularly a responsive answer, and that's only because there's a lot of uncertainty there. From a procedural perspective, it is important, although there are obviously bigger things in a pandemic. It is important for in a procedural sense that they are in recess, because the legislation that ArMA has worked on that was upended by the COVID-19 emergency is still alive. So to the degree that they're simply in recess, they could technically reconvene and pass, the discussion has been to pass some non-controversial bills. And if some of the things we have been working on, if the voting on them is any indication, there was a lot of support. These are non-controversial things that we could get passed. But again, we don't know. So they'll assess the situation, House and Senate. Presumably the President of the Senate and the Speaker of the House will assess things at the end of the month, and in consultation with the governor. And we will see whether they will continue, whether they'll either come back or continue in recess or not. The minority party, I believe, wants to adjourn. So there's a little bit of drama there, a recess versus a full adjournment. All of that is up in the air until the end of the month.
This is Megan. I'll add that you may have seen news reports that the Joint Legislative Budget Committee and other financial oversight organizations within the legislature provided an updated forecast late last week. And as you might imagine, those revenue numbers for the state are pretty grim. So part of the challenge with the decision when to reconvene, if they're going to reconvene at all, is really a budget question. And there's some differing views, as there typically is, between the majority and minority parties associated with whether they need to adjust the baseline budget that was passed before they went into recess based on those updated revenue projections. So at this point, as John indicated, of course, we're in a wait and see pattern for at least the next 2 weeks.
Great, thank you both. Just as a reminder, so before I go on to the next question, that if anybody does want to submit questions, there is the Q&A button at the bottom, or they can just raise their hand as well. We can offer you the opportunity to talk or just submit your questions, as well as there is the chat box for any general conversation that you would like to send if you'd like to send a message to the panelists or the entire group, feel free to do so. The next question I've got here is if there's any issues with ventilators at this point.
I am not aware of any. I know the numbers keep on changing. In fact, I'll do this live. I'm going to pull up that covid19.healthcaredata.org site, which has, the pretty good calculations. So according to them today, they're still predicting our peak to be April 30th, and that we're not going to have any issues with beds, but they're worried that we'll be about 200 ventilators short, which may or may not happen. So again, as we learn more about this and how to treat patients, hopefully we can get ahead of it. So I've not heard of issues with ventilators yet. I know every hospital's probably talked about preparations just in case. One thing for those who are taking care of these patients, one big thing, of course, is coming across is the proning of patients early and often before you need to put them on a ventilator. That seems to help with their aeration and oxygenation, so think of that. But at the moment, I have not heard of anyone asking for ventilators just yet. Hopefully we won't need to. So we're still keeping an eye on that. I don't know if anyone else has any further info, but that's all I got.
Great, thank you, Dr. Goldberg. One question that was submitted by an attendee. I'm not sure if we've looked into this much, but maybe this is something we could take back to our weekly call with ADHS, but in the absence of rapid testing, is there any value in app-based COVID tracking, such as the app COVID Symptom Tracker? I'm not sure if anybody has any background on the applications that have been pushed out yet, but maybe this might be something or an opportunity to bring this back with our weekly calls with ADHS.
I am all for bringing stuff to DHS because they are dealing with a lot all at once. So I think we can always put things in their radar. They appreciate it, actually. They don't get mad at us. They appreciate that we're coming with ideas and then offer to help. So because, yeah, I think we need to have a better understanding of what we're dealing with. We don't know the numbers. We have numbers from testing, but obviously testing is a small amount. It's been mentioned already. Probably the most infectious people are the asymptomatic patients, and there's a lot more of them than people realize. So how do you deal with that when you have limited testing? You need to be able to track things. So I think creative ways on how to deal with it and using technology is a very smart way of doing it. I don't know this particular one. I'm happy to look into it myself, and happy to bring it up the next time we chat with them.
Great, thank you, Dr. Goldberg. Another question that was submitted before tonight's call. My office is still seeing patients, but I'm not sure how to bill for them when they're on the phone or via FaceTime. Can we get paid for that? Megan or Juliana, would you guys be able to start us off with this answer?
It's Juliana. I'll take that one. We can absolutely get paid for telemedicine, whether it's telephone, FaceTime, or audio-visual connection through a telehealth platform. It isn't necessarily straightforward and simple, but it is definitely payable, as long as it's a medically necessary service that would have been covered in an in-person kind of setting. We created a telemedicine guide that is downloadable from our website, and that is on our telemedicine page. When you visit the Arizona Medical Association website, there's a dedicated telemedicine page. Just go on, fill in your email address, and you can download the whole thing. And there's a lot of questions available also just on the web page itself. But there's a helpful chart that will show you which carriers are recognizing what type of delivery method, how you should build that out. It's not specific. We can't tell you how to bill every single claim, but it's a great guide to get you started. And it's got links to each of the payer policies there as well. So it's super useful. And then if you have questions on it, you can always just give us a call.
I was just going to say that I think Juliana is a great resource for any practice that has billing questions. We've got contacts, thankfully, with with the insurers across the state. So if she can't help you, she can put you in touch with the right people to get your questions answered.
Great, thank you both. And I'd just like to throw out there too that ArMA does have that dedicated telemedicine webpage that Juliana has put together a lot of the content that's available on there, as well as a free telemedicine guide that you can download directly from our site too at any time.
Damien, one other quick comment
Yes.
around telemedicine is just to make everyone aware that ArMA has also partnered with CompuGroup Medical. I think you mentioned this at the beginning, but it's essentially a free telehealth platform for anyone that wants it. It should be relatively easy, quick setup for both the physician practice as well as for the patients. We've heard good feedback from those that are currently using that platform. I'd be happy to share the information and follow up from the call if anyone needs it.
That's an excellent point, Libby. We have heard that it's very simple and easy to use. It doesn't require a whole lot of setup time or integration with your EMR, which is beautiful for folks who haven't been doing telemedicine and don't necessarily have a platform set up. I had two thoughts. All right, that's it.
Thank you both. I appreciate that. One question from one of the attendees here, given the asymptomatic nature of the disease, do we feel we should all be using masks in public group settings and social distancing until a vaccine is available? And would ArMA implement such at the ArMA annual meeting?
I can't predict what we're going to do at a meeting that we're not sure is happening yet. I will say I just saw on CNN earlier today in Oxford, they're testing the 4th vaccine already on 500 people this month, 1,000 people next month, and they're trying to get something available for September. I think things are moving very fast and furious. I think we all need to continue to be cautious and mindful on how we do things. I think for right now, we keep the social distancing, but to ask what are we going to do a month from now, I can't predict because we have to see where we are with the curve. This is a day-by-day changing. We will be responsible and appropriately reactive when needed, but I'm not going to make a guarantee one way or another what we're going to do 4 months from now because I can't. it would be irresponsible for me to do so, to say one thing and we change it. So we will do what's best for our membership and keep everyone safe. And for right now, the rules are stay away from each other. As you can see, we're all staying away from each other by doing this Zoom conference. We will continue to do so for the foreseeable future until that changes, until we feel it's safe to do so. But we will go from there and kind of, I would recommend to people to wear masks, but again, the CDC are recommendations, not requirements. You have to do what you feel comfortable about doing right now, but I would still strongly recommend the social distance or the physical distancing, not social distancing. And then we will see where we are in August and go from there. Obviously, if we're still having problems, we will continue to do so. If we are ahead of it and we have minimized it, then things will be different, but we'll have to see where we are then.
Just a note from the governor's office, he's made several public statements that his stay home, stay healthy, stay connected order will remain in effect for the duration of the month of April. So at least for the next 2 weeks, which as Dr. Goldberg said, we have no idea where we'll be then, so TBD, but at least for the next 2 weeks, that will remain the policy of the state as well.
Great, thank you both. Another question here submitted prior to tonight's meeting would be, I would like to volunteer somehow, but I'm concerned about medical malpractice suits. I read that there is some protection available, but will it help me if I don't have a current license? I am retired.
Well, I can tell you the board is okay with that because they are actually, depending how far out you're retired, they actually are bringing people back to help. There is some protection for treating for COVID patients as well. I mentioned earlier, we have the executive order from last week focusing on those who are volunteering and helping treating for people for the COVID-19 issue. So there are opportunities for you that we have available on our website, or if not, we can provide you some links on how to get involved and where to get involved and where you keep yourself safe as well.
I will also add that Micah has been a great resource to us during this time, and we had some specific dialogue with them about retired physicians coming back into practice to help out in a volunteer sort of way. They've set some things up internally to make sure that from a med mal practice perspective, those individuals are covered. So we would be happy to put you in touch with the appropriate folks at Micah or any other agency to get your questions answered specifically.
Great, thank you. Looks like I have a comment here from Dr. Whiteley, just to remind the attendees that they can email her, Juliana, that there's a meeting with major insurers in the next week or two. If they have any telemedicine payment concerns, we need to know the specifics. So the next insurance meeting is soon. Thank you, Dr. Whiteley, for bringing that up. And I believe Juliana has put her email here in the chat to everybody as well, so you can see hers, or if maybe I'll have an email address up at the end of this as well. You can email the communications email address, and we'll make sure to forward along to the appropriate individual. See where else. I've got a couple more questions here. Do we have any numbers on how many healthcare providers have contracted COVID-19 in Arizona? The CDC reported some data, but nothing was broken down by state at this time. Would anybody know or be able to answer that one?
I do not
I
have
haven't seen any specific data.
I agree, it's something we should know, but again, the data is difficult. Again, we've had the fortunate or not fortunate, our numbers have been pretty low across the board compared to others, so I think that's why, but I can't tell you for sure who has, who hasn't. I know there are some residents and some attendings here and there that I've heard about anecdotally, but I have no true numbers to state confidently.
Great, thank you. Let's see, another question that was submitted prior here. How should we handle staff absences? Some staff have been exposed, some may be ill, and others have to stay home to take care of their family.
If you have staff, excuse me, if you have staff who are ill, they should definitely stay home. You know how to screen them for the COVID-19, and we definitely don't want them to come back to work prematurely. So it's important to have coverage wherever you can. Many staff members are able to work remotely. If you have billing staff who are out, they might be able to work from home because they might just be at home to take care of the kids who are at home from school, or they might have been exposed or maybe positively tested but don't have symptoms and can still work. And they might be willing and eager to work, actually, because it's nice to have something else to do but to sit at home. So you can set them up to work remotely. Another thing that you can do is to make sure that they know what their benefits are, and that you understand what their benefits are. The federal government, the FFCRA, Families for Coronavirus, Megan can correct me there, the Corona Relief Act, excuse me, my full-time employees are eligible for 80 hours of sick leave in addition to what they would normally have. Part-time employees are eligible for 2 weeks of sick leave in addition to what they would normally have at the same hourly basis that they would be working. So there are some things that you have to do. There are some things you can do, but cross-trained staff can often do double duty. Medical assistants can answer the phone and schedule appointments and set up patients for telemedicine. Nurses can help do almost anything in the office. Of course, they can't always do all of the billing and things like that, but cross-trained staff should be able to help cover in this crisis situation.
Great, thank you. Let's see, just want to make sure we get another question here from an attendee. What about quarantine for providers that have traveled within the U.S. recently or now? Does that warrant a 2-week quarantine? How does ArMA feel about that?
Well, I know that certain institutions have put their own rules already regarding travel. As someone that works for a hospital but also involved with the university, I know they actually have restrictions on out-of-state travel and how to deal with it if you do an out-of-state travel and what needs to be done. Honestly, if you're coming from an area that's known to be a hotspot, I think it would be safe and be a good idea to quarantine. Ideally, I think we all shouldn't travel if we can all help it. This is saying as someone who travels multiple times every month. I think I got airplane withdrawal at this point. I haven't been on a plane in like 6 weeks, and I'm feel kind of weird, that I'm not in a cramped seat somewhere, 30,000 feet above the ground. But I think we have to be careful about it. I always get worried about hard yes, no. I think if you're symptomatic, you should be isolating yourself. I think if you're coming from an area that you have known problems, then you need to be mindful of that you could be carrying something without realizing it. Realize if you're coming from one of those places and you were on a plane too, just because they're doing social distancing on the plane, the air is recirculated. So we don't know exactly what the transmission is for someone who's on a plane. I don't know. I don't know if there's data out there. I don't think people are testing that one particularly because less people are flying at the moment. So I think we need to be mindful if you are traveling, and you have to travel, some have to, and you're coming from these areas that are hotbeds right now, you may want to consider being mindful when you come back. Just like a hospital worker, a lot of our physicians are isolating themselves just coming from work so they don't get other people infected. I think you have to keep that in mind. That's a personal opinion. That's not an official ArMA statement, but I think it's a matter as a physician, you have to be mindful of that. And just right now, we don't know, as much as we know, there's as much we don't know. So you have to be prudent and cautious with whatever you do, is my opinion.
I will note the governor, one of the many executive orders that have come out over the last several weeks. The governor issued an executive order requiring quarantine for anyone traveling from New York, New Jersey, or Connecticut, I believe. And so at this time, those flights are being screened at the airport, and those folks are being asked to self-quarantine for 2 weeks. So as far as from a legal perspective, there is that mandate from the governor's office. Obviously, it's not, they're not going to barricade you in your house or anything like that, but just from a guidance perspective, that has been the governor's recommendation. And it is technically the same as the stay-at-home order. You can be liable for up to a misdemeanor if you do not comply with the order. So it is limited to those 3 regions at this point, but he can always expand that at any time in the future.
Great, thank you both. Looks like I got another question here. What do you think is the most important deficit in the governor and ADHS's current strategies for COVID-19? There any other, I'm assuming any other steps that could be taken or things? And I know that ArMA has been very active with making sure the physician voice has been heard on almost a daily basis with those important down at the Capitol, at the governor's office, as well as DHS too.
I don't think I would say it as there's an important deficit. I think we are trying to be mindful and provide guidance and expertise every step of the way. We are not the elected official of this state. The governor is going to do what the governor is going to do. We are going to agree with him on some things and not agree with him on others. I will tell you that I am not shy to offer my opinion on things. That's could be because I'm a surgeon, I am from the Northeast, take your pick. Just kind of my nature. So we will make sure when we disagree that we politely point out our concerns, because we still are working in this together. And we are going to have differing opinions, and this is a very complex issue. It is easy to say it's a straight up and down public health issue, but it really isn't. Nothing we do is just so simple and straightforward. So I wouldn't say there's a deficit. Do I personally think there could have been other things done a different way? Sure, that's my opinion. I also don't have an MPH. I'm not sitting and making these decisions, nor am I talking to every business in the state and saying to shut down and dealing with the millions of jobs lost and hundreds of millions of dollars lost. And I don't want to say that's not unimportant. It's an important piece to all of it. So we bring an important voice. We need to make sure we're an equal voice at the table along with everyone else. I'll answer to kind of tie in what Dr. Bradbury was asking too about the hospitals making decisions regarding elective surgery. You know, hospitals don't take care of people. They are buildings where things occur. So, you know, they have an important voice, but they're not the only voice. So again, we're going to push with the governor that yes, the hospital has an opinion on things, but we're the ones doing the work. And I could do the work. I ideally don't want to do it not in a hospital, but you know, in theory, the hospital is just a place for me to do my job. So they're there to help me. I'm not there for them. So we're going to make sure that that we're at least heard. I can't promise and guarantee 100% of the time you're going to get what you want, because no one does. But my only hope is that we are listened to, and we have a very good track record of providing sound concerns and reasons when we have issues. I think that's served us well. They know we don't fly off the handle and just start screaming and yelling about stuff, that we work with them if we disagree. And I think we'll continue to do so. Do we need more testing and PPEs? Yes, but everyone has said that. That's not a surprise, and nor is that a secret. Nor am I going to lay that at the feet of the governor. That's everyone and anything, you know, but none of us could have predicted the pandemic. How we respond now is just as important. So I would say is, you know, I think we're doing okay. I think there are things for improvement that we are working on and we'll continue to work on. And I would think anyone in any position dealing with this would say the exact same thing, that, you know, we want to keep moving forward and working together to make sure that we take care of everyone and keep everyone safe.
This is John Morris. I'll simply add that through this whole process, I guess in hindsight, you can make judgments on what's happened, and people will. But through this whole process, we've been pretty fortunate to have a direct line to the governor's office in terms of both kind of addressing things proactively in the case of, say, the liability protection executive order, as well as addressing things when problems arise. So setting aside the desire everyone will have to kind of judge these things, from ArMA's perspective, the most important thing is that we have an open door with the governor's office to raise our concerns, and we do it in a way that Ross has described. So that's the most important thing, and I'm glad we have it. And on behalf of our members, most importantly, I'm glad we have that.
This is Libby. I'll add one final comment, and that we're fortunate that we're not operating in a vacuum with this in our state. I mean, every state is going through this. We have great resources in other states as well. All the state medical societies have really been working together to share resources and what's working well in their states. We know that the governors are doing the same. And so I think that's really the key, is how do we continue to work together to learn from each other and our experiences to mitigate this the best way we can.
Great, thank you all. I think we're gonna stop there. I'm gonna share my screen again here real quick, just with this final slide with few final points here. Just a reminder for everybody, first of all, thank you everyone for participating in tonight's town hall. We're grateful that you all joined us. Just a reminder that this town hall was recorded. Will be available on the ArMA website within the next few days. Hopefully by tomorrow, we'll have it included in our Medicine This Week newsletter for our members. We would also like to mention, if anybody has any further questions or concerns that you'd like to be addressed, feel free to reach us at this communications.azmed.org email address. That'll get filtered over to the communications department, and then we can pass it along to the appropriate individual internally. Just another reminder as well of resources available to you on ArMA's website. We have the telemedicine resources, financial related resources to COVID-19, the COVID-19 frequently asked questions that we're continuously to work on with ADHS and updating as the world moves so quickly, as well as the telemedicine guide that's available for download on our website. I would like to also mention too, I know we have a few non-ArMA members that participated in tonight's town hall. I would just like to let you know that we did start doing a non-member email every Monday to all Arizona physicians to catch everyone up on the updates that are coming out every week. So feel free to email us at that communications email address, and we'll be sure to sign you up or pass along the link to where you can send to others to sign up as well. So with that being said here, I'll go ahead and stop sharing and just thank everyone for participating tonight. Did anybody else want to make any
Amy, and I just had
Go
one
ahead,
final
Debbie.
comment. I want to reiterate my personal thanks to each of you for participating. We would love to hear from you. As he said at the beginning, this is our first town hall in this type of a format. We'd love to hear from you on whether you felt like it was valuable, how we can continue to enhance it. And also if there are other panelists in the future that you'd like to hear from. We've had some initial dialogue with ADHS as well as Micah and a few other community stakeholders with the ideas that they might come on to a future one and be able to answer questions directly in this format. So if you think that would be helpful, if there are other groups that you'd like to suggest that we target, please do let us know and follow up from the webinar. But thank you.
Great. Thank you, everyone. We hope you have a great evening, and keep an eye out for the future town halls coming up.
Thank you for coming, everyone.
Bye-bye.